And welcome to ENZYMENTAL. I'm Jason Carter, and if you've ever experienced a urinary tract infection or UTI, you know immediately the burning pain, the constant and intense urge but inability to urinate, and the uncomfortable ache in your lower abdomen. These infections are uncomfortable at best and at worst can lead to severe pain and kidney infections. UTIs are also known as cystitis, and they are bacterial infections that affect the lower urinary tract or urethra and bladder and are caused when bacteria, typically E. coli, enters the urethra and attaches to the walls of the urethra and bladder. This bacteria is especially nasty because once it attaches, it forms a protective coating around itself that resists the body's normal immune response. Women are more prone to these infections than men because of their shorter urethras, although they do occasionally affect men also. Usually the first course of action for treating a UTI is antibiotics. However, there are natural compounds that protect the urinary tract and prevent bacteria from attaching in the first place, promoting urinary tract health overall. Two of these compounds are cranberry and D Mannose. The main bacterium that is implicated in causing urinary tract infections is E. coli, and this is not the same E. coli mutation found in unsanitary food that makes people sick, but rather it's the E. coli that's part of the natural microflora in our intestinal tracts. These E. coli microbes have tiny finger-like projections that allow the bacteria to stick to the inside walls of the urinary tract and bladder so they can't easily be washed away by urine. And this is where cranberry and D Mannose come in. Both of these have the ability to coat the E. coli bacteria, preventing them from sticking. D Mannose is a naturally occurring simple sugar closely related to glucose, but unlike glucose, it's absorbed at a much slower rate. Also, unlike glucose, D Mannose passes directly into the bloodstream largely unchanged. From the bloodstream, it then passes to the kidneys, where a large portion is added to the urine, where it flows through the bladder and urinary tract, coating and flushing out any E. coli bacteria that may be inhabiting that part of the urinary tract. Because it's a simple sugar, D Mannose is safe to take and has shown no clinical side effects. It will not raise your blood sugar. Cranberries contain proanthocyanins, which, like the D Mannose, prevents the E. coli bacteria from sticking to the walls of the bladder and the urinary tract. Additionally, cranberries are a natural source of D Mannose also. D Mannose is found in many different fruits, but cranberries are actually the richest food source of D Mannose that you'll ever find. So a UTI is nothing to ignore. If left untreated, it can progress into full-blown kidney infection. If you think you have an infection, you do want to see a doctor, but to help maintain urinary tract health and to prevent an infection from occurring, consider taking a cranberry and D Mannose supplement to keep E. coli in its place. You'll be very glad you did. Thanks for watching. I'm Jason Carter, and I'll see you next time on ENZYMENTAL. Stay healthy.